Hello everyone, welcome to Crack CMS, the only resource which you require to crack UPSC CMS. My name is Dr. Shashank and I have cleared my written exam in 2024 and I did give the interview this year. So here's my experience about the UPSC CMS interview and some tips and tricks to make this process a whole lot smoother. So let's begin. So what are the prerequisites which you have to keep in mind while going for the interview? First and foremost thing, you will require a copy of your e-summons letter. Without this, they're not even going to let you inside the gate. You need to download the e-summons letter and keep it ready. Along with that, you need to carry two passport size photographs for the interview specifically. And you need to take all your original documents, that is your 10th marks card, which is going to serve as proof of your date of birth. You need to take your degree certificate and you need to take your internship completion certificate. So people who are doing internship or for some reason you don't have these documents, it's totally fine. You can submit these documents later on. It's not an issue at all. Then you need to carry a self-attested photocopy of all these originals. Self-attestation means you need to sign on the Xerox copies of these documents. You can take your TA form beforehand or you can fill the TA form that they give there. And you need to keep your tickets, a Xerox copy of the tickets. It can be a railway ticket or an airway ticket. It's totally fine. They're going to contribute as per their guidelines. So this is how the entire interview day looks like. I've broken it down to 5 to 6 individual processes, which starts with a security check. So on the day of the interview, you're going to end up on this side of the road where my pointer is on UPSC Bhavan, Shahjahan Road. So at sharp 9 a.m., the security is going to open the gate or at 1 p.m., whichever shift you have gotten. And they're going to verify your e-summons letter with the list of candidates they have to check whether your interview is on the same day and your roll number is matching. And after that, you're going to go through a security check where they're going to frisk you and they're going to scan all your bags. You can take your bag and luggage. It's not an issue. Once you enter, there are two buildings. The circular building, which is seen over here, is known as Dolpur House. That's where the interview for civil services takes place. And for CMS, the interview takes place in the main building. So this is the floor plan of the main building. So once you enter, you need to go straight away to the reception where you have to give your phone and you have to give all the Bluetooth devices or wireless devices. They're going to put it in a cover and they're going to issue you a token. Once you take the token, you need to go to the next counter where you have to sign. Once you sign, that is considered as your attendance and you're not allowed to exit after that. After you sign, they're going to you need to go to the registration counter where they capture your biometrics and your photo, and you will be allotted one of these 5 to 6 rows where you have to be seated. Each row will have a staff who is going to help you with the entire process, and they're going to give you 4 to 5 forms which you have to fill. And in one of those forms, there is a provision which states that I have not been able to submit so and so documents, and you have to list down what all documents, and you can submit them later on. The staff is going to collect all the documents which you have, the original documents. He's going to go to the verification counter, and after verification, which takes about 10-15 minutes, he's going to return those original documents and he's going to take a sign that he has returned all the documents. Meanwhile, they're also going to give you a form where you have to fill where you want to get your medical examination done, which is going to be on the next day. I'll cover the entire medical examination process in the next video. And once you fill that, they're going to give you a TA form, or you can have your TA form filled beforehand before going there. And the TA officer usually sits near the entry gate, and so he's going to calculate the exact amount that needs to be reimbursed to you. Next to that, there's going to be a snacks counter where they'll have juice, coffee, tea, and you can just chill while waiting. And after this whole process gets done, you need to wait for your turn for the interview. And this is the most crucial part. And it's absolutely essential for you to stay calm. So once your turn comes, you're going to exit through the other side of the other side of the room, and there's going to be another security check. Once that security check takes place, you need to keep all your bags. You need to empty all your pockets, and they're going to frisk you again. You go through the lift to the third floor or the fourth floor, wherever the interview is, and you're going to face the panel. Now, here comes the most important thing which you actually traveled there for, the interview. How is the interview going to be? This is a golden question which everybody has in their mind. What are they going to ask? How is the interview going to be like? How should I prepare? So, in short, there is no way you can be absolutely 100% prepared. The questions they're going to ask is absolutely random and it totally depends on how you lead the interview. Keep in mind that this is a personality test and not a viva voce. Whatever medical knowledge which they had to test, they tested it in your written exam. This is mainly to assess your personality and get to know you better. So the average duration of the interview is going to be around anywhere from 20 to 30 minutes, and it can extend up to 50 minutes also in some cases. So how my panelist was that the chair was an IAS officer, and I had a medicine and a surgery faculty. And some people had an obstetrics or a pediatrician or an orthopedics faculty as well. So the panel will be usually 3 to 5 members. So once my turn came in, I entered the room, and the IAS officer made me feel comfortable. He asked me a few questions, and usually he starts the interview, and he's going to ask basic questions like where I am from, and what's my background, where did I did my schooling, where I did my college, and what branch I want to take. And this is one of the questions which mostly repeated with everyone was, how was your NEET PG? What rank did you get? And what are you going to do if you have to choose between UPSC CMS or NEET PG? Now, the logical answer is you're not going to choose for NEET PG because there is no point if you're going to take a PG seat that you're going to sit in the UPSC interview when you're already getting a PG seat. So most people who had got a mid-range rank justified that they're not going to get a branch of their choice, and they're going to give an attempt next year while being in service, or they're going to wait for 2 3 years to claim the benefits of the CMS by taking a study leave or by taking a sponsored quota. And for some people, they asked, what is your approximate marks in the written test, and these kind of questions which are things which you don't actually prepare for. And if you have filled about any hobbies, the IAS officer is going to dig deeper on that. And after that, the interview goes into the hands of a medicine or a surgery faculty. So I was interviewed by the surgery faculty, who asked what are the common emergencies that I saw during my internship and how I manage them. And then she went deeper into varicose veins, like how do I diagnose them, and what are the investigations which you do, what are the different types of surgeries for varicose veins. Then she asked a bit about the minimal access surgeries. And after that, after 10 15 minutes of surgery faculty, this thing shifted to the medicine faculty. I had specifically worked in a neuro institute, so they asked mainly about CNS cases. What were the CNS emergencies? So a good idea would be like to prepare about emergencies. One of my friend had worked in a PHC, so they asked him all about the programs and what would he do in a low resource setting. And one of them was an athlete, so they asked all about sports injuries. So the panel does not have a fixed set of questions. They asked how you guide them. So all you need to do is practice your introduction. You need to be thorough with your diaphragm, and that's about it. And know a few basics, and that should easily get you through this interview. Now, post interview, you come down and you collect your travel allowance. And after that, you can roam around the campus, chill a bit, and exit. So I hope this video was helpful, and all the best for your interview, and hope you crack this.